Hello all, welcome to the Pathophysiology lecture series. Today I want to discuss about the schizophrenia. So many of we familiar with the word schizophrenia. So schizophrenia is a psychotic disorder. Many of cases we also called as a mental disorder, psychosis. Okay, the psychosis is a very early condition when a person suffering with a prolonged mental disorder we consider as a schizophrenia. So schizophrenia is a chronic heterogeneous syndrome of disorganized and bizarre thoughts, delusions, hallucinations, inappropriate affect, cognitive deficits, and impaired psychosocial functioning. So mainly we'll see hallucinations, delusions, disorganized speech and behavior, and complete impaired of the psychosocial functioning. Uh, so hallucination generally it is called as a perception of having seen, heard, touched, tasted or smelled something which was not really present. So we call as a false perception. Okay. So many people they come a complaint about the just now I heard something, just now I touched something, just now I see something. Okay, and just now I smelled. Okay, in a real world all those things are not there. Okay, they are in a virtual world. So that we call as hallucination clinically. Delusion is another key manifestation of the schizophrenia, where the people have a false belief and false conflict with the reality. Okay, so always they will believe in a wrong thing in a real world which is not there. In a simple example, we might heard a rabbit with a three legs, okay, or a dog with a three legs, okay. So like that we used to hear some stories, okay. Those are all comes under the delusions. And when coming to the etiology of the schizophrenia, the exact cause of schizophrenia was not clearly understood. Many of the cases we feel that genetic predisposition is the key factor, and environmental triggered issues. Okay, apart from these neurodevelopmental theories or neurotransmitter abnormalities, we also consider as the hypothesis for the incidence of the schizophrenia. Among all these hypotheses, the first one is the genetic predisposition, where we don't have exact data which particular gene mutation is causing the schizophrenia, but important factor is the first degree relatives have a high risk. Okay, say for example in a family your father or a mother side they have a schizophrenia issue, almost there is a possibility for the incidence of 10%, almost 10% risk is there. And another important factor is the monozygotic twins. Okay, where in a case of identical twins where there is a possibility for schizophrenia in one baby. Particularly these also will depend on the mother nutritional status and growth and development of the both twins, but most probably 40 to 65% of risk is there for the identical twins to get the schizophrenia. The second important factor is the environmental factors, socio-dynamics, drug abuse, viral diseases, malnutrition, drug abuse in a pregnant woman. Particularly in a childhood level, malnutrition is the key factor. In a particularly children, if they are in a malnutrition condition, it completely affects their growth and development. So in a later level, there is a possibility for the schizophrenia. Apart from that, socio-dynamics, it is a key factor where low socio-economic status, poor living conditions, it completely restricts the individual from doing the activities, financial issues, financial struggles, and family conflicts. These are all have an impact on the children so definitely there is a scope for the development of the stress. The stress later level may lead to the schizophrenia. And in a pregnancy level, drug abuse, alcohol, smoking, these are all key important risk factors. Completely these things will affect the fetus development. And apart from these, in a pregnancy level, maternal stress or uterine stress, okay, uterine disturbances, all have an impact on the baby growth and development. So that's why pregnancy is a key phase. Depend on the healthy status of mother and depend on the healthy habits of mother, the growth and development of baby will be there. And as I said, these neurotransmitter abnormalities, particularly dopaminergic hypothesis is a key phenomena in the development of schizophrenia, where dopaminergic hyperactivity or hypoactivity may lead to the certain abnormalities in a brain regions, particularly in a frontal lobe, in a prefrontal lobe. Okay, so those may lead to the development of the problem. Particularly, we see hyperactivity of dopamine in a mesolimbic system may lead to the positive symptoms. So, what we discussed in the introduction slide, hallucinations, delusions, okay, inappropriate speech, behavior, all these are all comes under the positive symptoms category. And dopaminergic hypoactivity in a mesocortical system may lead to the negative symptoms, which are characterized by no emotion, no expression, alogia, okay, and where complete a blank face. These are all the things we'll see due to hypodopaminergic activity. Okay, and the last important thing is the neurodevelopmental model, where in a neurodevelopmental model, particularly as I said earlier, also in a pregnancy level, how healthy the mother and how good the nutrition and habits, based on that the baby growth and development will be there. Particularly the uterine disturbances in the second trimester, where it is a key phase for the neurodevelopmental process. So that may lead to the some neurodevelopmental abnormalities in the baby. And apart from that, respiratory tract infections or some complications during the pregnancy level, or complications at the time of delivery or post delivery. So okay, all this may have an impact on the baby. And apart from these, one more important factor is the low birth weight babies. Okay, particularly the babies who have weight less than 2.5 kgs, there is a high risk for the occurrence of schizophrenia. Okay. In a neurotransmitter abnormalities, we discussed one aspect of the dopamine hypothesis. Apart from that, there are two more important aspects are there. One is glutaminergic dysfunction and the serotonin abnormality. So we know serotonin is a key important neurotransmitter for the relaxation of the individual. Whenever there is a low levels of serotonin may lead to the altered in dopaminergic activity and increased stress levels. And more glutaminergic dysfunction may lead, or decreased glutaminergic activity may lead to the changes in the dopamine activity. Particularly we'll see hyperactivity of dopamine. So that hyperactivity of dopamine is the key factor for the schizophrenia symptoms. So as I said, in a schizophrenia mainly we'll see three types of manifestations. One is a positive symptom, second one is a negative symptom, and third one is the cognitive symptom. Okay, in a positive symptom where the people have abnormal behavior rather than the natural, excess, we can say positive means excess, okay, compared with the normal. Okay, that's why they have these false beliefs, false thoughts, okay, and they all have a false perceptions. False perceptions we used to rename as the hallucinations, okay, disorganized speech, behavior. And in a case of negative affective flattening effect, okay, there is no emotion, no expression, okay, they have different they are used to avoid the situations also. Cognitive dysfunction is the another key parameter. Generally we'll see in severe cases, cognitive deficiency may lead to the impaired attention, loss of memory, and impaired executive functioning. So where the individual completely failed to do the normal activity. So here you can see the pathophysiological scheme of schizophrenia, where one factor is the genetical factor. As I said, we cannot know, we don't know exactly what is the gene abnormality causing the problem, but we have two important factors under that. One is the monozygotic twin, and the second one is the first degree relatives. Okay, so those two abnormalities have a high impact. Okay, and apart from that, the second important thing is the biological theories, where in a biological theory we have a socio-dynamics, okay, environmental trigger factors. So all these things, guilty, okay, and also social humiliation, all these have an impact, and it may lead to the development. And the third important aspect problem is the dopamine hypothesis, where glutamate deficiency or hyperactivity of dopamine may lead to the abnormal behavior and abnormal thoughts. Okay, so these are all factors may initiate the problem. Okay, and these things particularly will lead to the increased dopaminergic neurotransmission in mesolimbic projection, or decreased dopaminergic transmission in mesocortical system. Okay, so these two factors, either hyperactivity of dopamine in mesolimbic system may lead to the dopaminergic neurons may project into the limbic system, where it majorly responsible for the control of individuals' behaviors and emotions. Okay, so due to hyperactivity, so the person will behave abnormally in aggressive mode, and emotions will be at very high and abnormal level. So that is the one factor. And the another important factor is the hypodopaminergic activity in the mesocortical system, where this mesocortical system is very important for the individual thinking, decision making skill, language production, and the mood. Because of low dopamine activity, we will see complete fail of thinking ability, and poor decision making. Because of poor decision making, they will behave abnormally. At a place of death, they might laugh, or at a place of enjoyment, they might cry. Okay, this is how we will see abnormal decision making. And there may be difficulty in language production. That's why they are feel difficulty to speak. They don't feel free to speak also. And mood disturbances, they are in a low mood. Okay, so this is how the behavior will be there. And because of all these things, we are seeing the negative symptoms in a person. Okay, and in a case of hyperdopaminergic activity, due to failure in behavior and emotion, we'll see the abnormal dopamine transmission. So that may lead to the development of all these positive symptoms like delusion, hallucinations, okay, speech, disorganized speech, and disorganized behavior. Okay, so here you can see in this picture also, where this blue color is indicate the nigrostriatal pathway, dopaminergic pathway, where activity in the mesolimbic system may produce the positive symptom, and hypodopaminergic activity in the mesocortical system may produce negative symptoms. Simultaneously, hypodopaminergic activity, the infundibulus system also produces the neurocrine endocrine disturbances. Apart from all these things, there is a risk of extrapyramidal side effects also due to hypodopaminergic activity in the nigrostriatal pathway. Okay, so that is about the pathophysiology of schizophrenia. Thank you.